First, your doctor or dermatologist, a doctor who specializes in skin problems, will try to determine the underlying cause of your hair loss. The most common cause of hair loss is hereditary male or female pattern baldness. Please like, share, comment and subscribe. Thank you for your love and support. If you have a family history of baldness, you may have this type of hair loss. Certain sex hormones can trigger hereditary hair loss. It may begin as early as puberty. In some cases, hair loss may occur with a simple halt in the cycle of hair growth. Major illnesses, surgeries, or traumatic events can trigger hair loss. However, your hair will usually start growing back without treatment. Hormonal changes can cause temporary hair loss. Examples include pregnancy, childbirth, discontinuing the use of birth control pills, menopause. Medical conditions that can cause hair loss include thyroid disease, alopecia areata, an autoimmune disease that attacks hair follicles, scalp infections like ringworm diseases that cause scarring, such as lichen planus, and some types of lupus, can result in permanent hair loss because of the scarring. Hair loss can also be due to medications used to treat cancer, high blood pressure, arthritis, depression, heart problems. A physical or emotional shock may trigger noticeable hair loss. Examples of this type of shock include a death in the family, extreme weight loss, a high fever. People with trichotillomania, hair-pulling disorder, have a need to pull out their hair, usually from their head, eyebrows, or eyelashes. Traction hair loss can be due to hairstyles that put pressure on the follicles by pulling the hair back very tightly. A diet lacking in protein, iron, and other nutrients can also lead to thinning hair. How is hair loss diagnosed? Persistent hair loss often indicates an underlying health issue. Your doctor or dermatologist can determine the cause of your hair loss based on a physical examination and your health history. In some cases, simple dietary changes can help. Your doctor may also change your prescription medications. If your dermatologist suspects an autoimmune or skin disease, they might take a biopsy of the skin on your scalp. This will involve carefully removing a small section of skin for laboratory testing. It's important to keep in mind that hair growth is a complex process. It may take time to determine the exact cause of your hair loss. Medications will likely be the first course of treatment for hair loss. Over-the-counter (OTC) medications generally consist of topical creams and gels that you apply directly to the scalp. The most common products contain an ingredient called minoxidil, Rogaine. According to the AAD, your doctor may recommend minoxidil in conjunction with other hair loss treatments. Side effects of minoxidil include scalp irritation and hair growth in adjacent areas, such as your forehead or face. Prescription medications may also treat hair loss. Doctors prescribe the oral medication finasteride, Propecia, for male pattern baldness. You take this medication daily to slow hair loss. Some men experience new hair growth when taking finasteride. Rare side effects of finasteride include diminished sex drive and impaired sexual function. There may be a link between the use of finasteride and a more serious type, high grade, of prostate cancer, according to the Mayo Clinic. Doctor also prescribe corticosteroids like prednisone. Individuals with alopecia areata can use this to reduce inflammation and suppress the immune system. Corticosteroids mimic the hormones made by your adrenal glands. A high amount of corticosteroid in the body reduces inflammation and suppresses the immune system. You should monitor side effects from these medications carefully. Possible side effects include glaucoma, a collection of eye diseases that can result in optic nerve damage and vision loss, fluid retention and swelling in the lower legs, higher blood pressure, cataracts, high blood sugar. There is evidence that corticosteroid use may also put you at higher risk for the following conditions: infections, calcium loss from bones, which may lead to osteoporosis, thin skin and easy bruising, sore throat, hoarseness. Medical procedures. Sometimes, medications aren't enough to stop hair loss. There are surgical procedures to treat baldness. Hair transplant surgery. Hair transplant surgery involves moving small plugs of skin, each with a few hairs, to bald parts of your scalp. This works well for people with inherited baldness since they typically lose hair on the top of the head. Because this type of hair loss is progressive, you would need multiple surgeries over time. Scalp reduction. In a scalp reduction, a surgeon removes part of your scalp that lacks hair. The surgeon then closes the area with a piece of your scalp that has hair. Another option is a flap, in which your surgeon folds scalp that has hair over a bald patch. This is a type of scalp reduction. Tissue expansion can also cover bald spots. It requires 2 surgeries. In the first surgery, a surgeon places a tissue expander under a part of your scalp that has hair and is next to the bald spot. After several weeks, the expander stretches out the part of your scalp that has hair. In the second surgery, your surgeon removes the expander and pulls the expanded area of scalp with hair over the bald spot.